What we know is that COVID has had a much bigger impact on Hispanics or Latinos in our state than other groups. So the rates of infection have been higher, and more folks have died. Latinx and Hispanics have died from COVID on an age-adjusted basis than other groups. Similarly, higher rates of hospitalization. We don't know much, is the answer. We have some data from a couple of surveys that have been done that are not, it's really very early on and not very in-depth in terms of the information we have about long COVID and Hispanics or Latinos here in the state of Washington. It's more common in people who have had more severe illness, people who have been in the hospital, for example. So just based on what we know about infection rates and hospitalization rates, there's a lot of concern that long COVID is much more prevalent than currently recognized among Hispanic or Latinx communities. The most important thing with this study is to influence the care and resources the community receives in response to the impact of long COVID. So that's really what the goal of the study is. We want to understand how prevalent long COVID is, what kinds of symptoms people have, what kind of impact it has on their health and well-being, in order to help mobilize a response. The study is being supported and funded by the Latino Center for Health at the University of Washington, along with the School of Medicine and the Allen Institute for Immunology. Our community partners are the Yakima Valley Farm Worker Clinic and Seymour Community Health Centers. We will be collecting data starting in January of 2023. We expect to start seeing results from the study early summer. And we'll be sharing those out broadly with community members and policymakers here in the state of Washington. So I think there may be many Hispanic or Latinos in this state that don't recognize they have long COVID. If you have symptoms like fatigue, trouble thinking, pain, difficulty breathing after you've had an infection with COVID, you should seek care. You should talk to your doctor or find a doctor, because you may have long COVID and there are therapies that may be helpful for you.